There are definitely concerns from parents with children with disabilities when it comes to health concerns for outdoor play. And I think the way to mitigate those concerns is you have a plan ahead of time for any type of circumstance that could come up.
When we're thinking about physical health concerns, your number one tool is to speak with families. So keeping those lines of communication open, just to really get to know what is safe for that child and what is not.
We mitigate all concerns by really having those conversations of like, I noticed this about your child. If there's anything that you know that would be very pertinent to their outdoor play, please let us know.
We're really open to working with families to see what works best for them and what works best for their specific child, because there's no blanket way to help every child the same. We adapt to every child's needs.
Hi, I'm Amy Jo, and I'm a resource consultant and an outdoor adaptive champion with the Canadian Centre for Outdoor Play Sprout Able project. I'm here to talk to you today about the importance of playing outside, how to support families who might be hesitant to have their child play outside because of health concerns, and how to navigate these concerns as the child's educator. Children with disabilities may have health concerns that must be managed and monitored to support them in being able to play outside safely. Some children may be more prone to dehydration or heat exhaustion, they may get cold more quickly than others, or they may not be able to communicate their needs, such as when they are feeling thirsty or cold. For some parents, it might feel more manageable to keep their child inside than to manage these risks. But as an early childhood educator, you know that playing outside is so important for healthy development, and that it is possible to support all children during outdoor play. Take a look at this scenario and think about what considerations you'd want to be mindful of and how you might navigate this situation.
Good morning, Alex. Are you ready to join your friends outside?
It's already getting warm out there. I think it would be best for Alex to play inside today.
The educator could respond in a number of ways. Think about how you might respond in this situation. The educator could follow the parent's request. Let's see what that would look like.
Okay, well, we couldn't keep a group inside. Alex, you can play inside today.
Now let's look at an alternative response. The educator could discuss the importance of outdoor play and how they will support the child.
I understand you think it might be best for Alex to stay inside today. We always start our mornings with outdoor exploration because playing outside is so beneficial to the children's growth and development. Can you tell me more about your concerns with having Alex play outside today?
I don't want Alex to get too hot because he can get dehydrated easily. I'm worried he might get thirsty, but he will be able to tell you.
I hear you. Dehydration is a valid concern on hot days. We do ensure that all the children have frequent water breaks, and fortunately there is plenty of shade under the trees. I understand the heat is especially a concern for Alex, so we'll make sure he has frequent water breaks and monitor his water intake. Alex, I see you had your hat and some shirt to help keep you cool. That's great. We'll also keep an eye on the weather and head back inside before it gets too hot. How does that sound?
Yeah, that might work.
I can share our current hot weather policy with you, and we can develop a plan specifically for Alex. That way, all the educators will be aware that we need to check on him regularly.
That would be good.
Great. I'll submit to you today, and we could chat more about it at Picked Up.
When navigating situations like this one, it is important to pay attention to what the child's needs are and what they need to be safe and healthy outside. Acknowledge and validate the family's concerns. Ask questions to find out what their main concerns are and to find out more specific medical information if needed. Let them know how risks are assessed, mitigated, and managed. Problem solve together how best to address their concerns, and reassure families you are here to support them and their child. Depending on your specific situation, you may also want to consider the priorities of each member of the child's care team, such as their doctor or occupational therapist, whether additional staff are needed to support the program, if your program has access to resources such as an outdoor gear library, and if there is information or resources you could share with the family. Check out the resources we've linked on the Sprout Able Project website. You'll find information on the importance of getting all children outside, how you can support children with disabilities, and resources to share with families.